Hi everyone, I hope you had a great weekend. Well, today we want to talk about something different. First, let me introduce this amazing yoga teacher, Nikki. She's been working with us for a while, and today I thought it was time to get on the show to talk about the importance of yoga therapy. Now, a lot of us know about yoga and different asanas and different schools of yoga and all of that stuff. But you see, yoga is a science. There's something much deeper than just a practice that you do. There is something called yoga therapy. And we've been using this in integrative medicine for the last 5 to 8 years. And you'll wonder, how does it fit into my life? Well, you see, today, spirituality has also become a fad. Spirituality has become a bypass to good health. So people on their to-do list, they have a chanting class, they have a meditation class, they have a yoga class, and then they believe their job is done. But you see, when you're in the practice of yoga, it doesn't end there. It ends in carrying what you learn in your yoga and applying it to your day-to-day life. So if you learn posture through different asanas and yoga, and you end up going to work and you're slouched over your desk for the next 9 hours, your 1 hour yoga class is practically useless, almost useless. If you learn pranayama and how to control and how to use your breath, and you don't use it outside of your class when you're in a stressful situation, when you're in arguments with your boss or whatever it is and stuff like that, your practice is literally useless. The idea of yoga therapy, the science of yoga, is applying what you learn into your day-to-day life. And yoga, that's why they say it's a way of life. Now, Nikki's with us. She's a yoga therapist. There's a huge difference between a yoga teacher and a yoga therapist. There are a lot of people out there who can teach different asanas to people, and then there's a whole set of people who assess you. They understand your body, they understand your mind frame, they understand the emotions that you're going through, and they put a practice together that is suitable and personalized towards your type. So you find today a lot of people get injured in yoga classes. They have back issues, they have knee issues, because this concept of one shoe fits it all doesn't exist anymore. That's the reason why the world is sicker. We have like 100 patients with breast cancer, ER positive, and you have the same protocol of chemotherapy being given to all of them. It works for some, it doesn't work for the others. So when it comes to integrative medicine, you got to find out what works for you, because every individual is different and unique. The same thing with yoga. The same yoga class is not going to work for your individual needs. But when you sit down with a yoga therapist or a specialist, they assess your body, they assess your life, they assess everything around you, and they design a practice for you, which could be 20 minutes, could be 15 minutes, could be an hour. It depends on you. This mindset of having an hour for yoga doesn't have to work for everyone. For some people it's 15 minutes, for some people it's 20 minutes. So Nikki, over to you. As a yoga therapist, can you tell us your findings when it comes to, I know you've been handling cases with cholesterol, diabetes, PCOD and all of that, and now you're working on cases with cancer as well.
Yes.
So what is your learning been when people apply yoga therapy to their healing?
Yeah. Well, Luke, first of all, thank you so much for having me here.
It's a pleasure.
As you said, Luke, everybody's body is different, and we should respect that uniqueness. Everyone is different. Everyone's body is different. The flexibility, their mindset, the problems they're going through. So you have to keep all this into consideration while you treat that person. So a person might come with thyroid. Two people might come with the same problem, but their stress levels, their lifestyles, everything is different. So you have to take all of this into consideration. And through my years of practice and trying to heal people through yoga, I have learned that you cannot just treat someone through physical activity, but you also have to pay attention to the mind and the breath, because you have to focus on all aspects of a being, because everything in our body is interconnected. So you can't just focus on your physical activity and say that, okay, today I did 1 hour of running or 2 hours of yoga or whatever, and if you don't pay enough attention to managing your stress levels or getting enough sleep or following a proper diet, so that's not going to work at all. Eventually that is going to show up as problems in your digestive system, the functioning of your body. So of course you have to look at all aspects aspects of the body. Also, when we treat someone through yoga, example thyroid or diabetes or blood pressure, so through yoga asanas, of course all yoga asanas are very beneficial for losing extra fat, for blood circulation, for proper breathing, for managing stress levels. So when a patient comes to us, we take into consideration what his lifestyle is like, what are his stress levels, what is he thinking, what is his diet like, what is his flexibility like, is his body too stiff? If he's suffering from thyroid, we would pay much more attention to this part where the thyroid gland is located. So asanas which include positions which massage this part, so that helps stimulate the thyroid gland and help balance the production of the hormones and increases metabolism, balances everything in the body. So we have seen a huge difference in the people's health, their stress levels. They feel calmer, they feel more confident. Of course, problems in life are inevitable, but everybody has it. But we become more confident to face the challenges that come.
Yeah, and just to go back, like thyroid, like I keep talking to people about thyroid. I mean, there's such a direct correlation with stress, no matter what anyone tells you. Because if you decide today to look at the anatomy of the thyroid gland and the function, right from the endocrine system to metabolism, okay, you see the sluggish metabolism in an underactive thyroid gland. And then people are told to do what workouts you want, and some of them are running kilometers and kilometers, they're training heavy, they're doing CrossFit, and their thyroid just doesn't get better and better. But then the medical professionals are willing to give you more and more medicines without telling you that, hey, listen, ease up on your workouts. Because the more you work out, the more strenuous your workout is. When you have thyroid, okay, the body automatically starts slowing your metabolism more and more. So the whole idea is first build up your gland through yoga, light walks, and so you see everything needs to be individualized.
Exactly.
It's very difficult for someone with a thyroid problem to have a heavy workout and get off thyroid medication at the same time. So again, you start off with asanas, you start off with yoga. So while we're on this point, what I've learned recently as well is that a lot of people just jump into meditation, or some people take pranayama and say, I do half an hour pranayama. What I've been given to believe is the fact that your asanas prepare you for pranayama and your pranayama prepares you for meditation.
For meditation, of course. Because most people are so used to sitting on chairs. They can't even sit on the floor. So first we make a person flexible enough to sit on the floor for an extended period of time. So when asanas make you more flexible, make your muscles, your bones much stronger. You can sit on the floor for a longer period of time, and when you do your pranayama becomes easy. Your focus from the pain in your body goes to your breath, and that itself takes you higher towards meditation. Towards when you go to the higher stage of meditation, nothing else disturbs you. That's like a calm place to be, but you have to go step by step. So in class we start with basic asanas, and then we do a little bit of pranayama, and then slowly and steadily we take them towards meditation. So it's like a step by step procedure, and all these things have to be kept in mind. You cannot just jump from one thing to another. You have to take it slowly and steadily without comparing yourself with your neighbor who is sitting next to you or with anybody else. We are all on our own separate journey, and we have to respect our uniqueness.
Yeah, that's beautifully put. So right now I think it's fair for me to say that if your yoga class is not leading you from an asana to pranayama and eventually meditation, it's not a complete class.
Of course.
Absolutely, because I see the difference. When I do meditation without doing my asanas and pranayama, it takes me more time to get settled. But when I move from my pranayama, my asanas to pranayama to meditation, it's easy. I'm in it like within minutes. And so a lot of people out there say meditation is difficult, we're restless, thoughts all over the place, because I guess there is a process that leads us. And this is what yoga is. This is the whole concept. So today, even when we use it for healing with our patients, we want people to embrace the whole thing. And we need to change our mindset, like we always say. When we tell people who are sick to do yoga, they immediately think, oh, it's 1 hour of twisted moves and asanas and it's going to be difficult. But I know yoga therapy classes where the practice gets over in even 7 to 8 minutes. And it could be something as simple as raising your arm, keeping your breath in sync with your movement. And I think, our Prime Minister talks about yoga in the country, and I really feel that we need to create awareness about the right kind, because everything's become a fad. Nutrition's become a fad, exercise has become a fad, spirituality's become a fad. So I think it's a good idea for us. So the good thing with Nikki is I'm going to steal her for a while because we want to launch a series where we're going to talk about thyroid, and the next time out of the office and straight into the studio, Nikki's going to demonstrate simple asanas that you can do at home. Whether you have thyroid, it's going to be specific for thyroid, PCOD, hormonal issues, diabetes, and whatever else she comes across in her line of work. So we're going to talk about the condition, and she's going to demonstrate a couple of easy asanas that you can do. And I think when we collectively start doing these things together, I think we can basically progress. So what's your message for people out there, Nikki, in terms of yoga and yoga therapy? I know you've changed so many lives, and I know every time I see you, I run away from you because I'm doing it the wrong way, just because of lack of time. But what's your message for people out there in terms of yoga therapy? Can you tell them, how a yoga assessment goes? So if someone I've been for yoga assessment, so I know what it is. What about you? If someone had to come for a yoga assessment, not to you, it could be to anyone. What happens in a yoga assessment really quick?
Yeah. So if someone came to us for yoga assessment, first we take into consideration what he or she is suffering from. Is she going through stress? How can we manage the stress? So if she's going through a lot of stress, we put in a lot more of pranayam. We take her more towards pranayam, meditation, also asanas. Many people feel it's just a physical activity, but it also plays a great role in relieving stress. So we take all this into consideration. We also make them do a few asanas and try and study their flexibility and what needs to be worked on more, what parts of the body needs to be paid more attention to, keeping in mind their disorder or whatever they're suffering from, whatever their problem is. So we are here to help people, and they are welcome to come.
I see you have a lot of bodybuilders as well and athletes
Yes.
now who are coming for yoga, and that's
Yeah.
brilliant because a
Yeah.
long time ago we thought physical fitness was all about strength and
Yeah.
looks and all of that stuff.
Exactly.
But half of us are inflexible,
Yeah.
and that's a huge block for us.
Yeah, so flexibility is really important because it helps in proper blood circulation. Also, it enhances your workout. So we are not saying that if you're already working out at the gym, you should quit working out and join a yoga class. That's not what we are saying here. We're saying that you can, take into account all kinds of fitness. Like if you're working out, you can also do yoga on other days. If not 1 hour, maybe half an hour or 20 minutes to increase your flexibility, also manage your stress levels, calm your heart rate, because when you work out your heart rate goes high. There is stiffness that comes in, so flexibility improves all of that. It also prevents injury taking place during your workout.
Right.
You can work out longer due to yoga because your energy increases, your strength level increases. So there are lots of benefits doing yoga, not just in terms of combating lifestyle disorders, but also preventing them. And yoga is not just for people who are suffering from lifestyle disorders, but also for people who are not, like who are completely healthy, but who want to become more flexible, want to become more energetic, want to breathe better, want to bring a glow to their skin,
Absolutely.
So
Yeah.
there is something for everybody. But
The glow to the skin, that's important because we handle a lot of models and Bollywood and all of that stuff.
Yeah.
And believe me, a lot of us think that they're on pills to improve the glow and stuff. Let me tell you right now, there is no pill that can improve the glow in your skin.
Yeah.
It is the blood beyond, beneath the capillaries behind your face, so before they go on stage, before they do that, there are certain asanas that
Yeah.
rush the blood to your face and capillaries, and that glow that you see is natural. You can have that same glow when you're doing it the right way.
Exactly. Also in asanas, we have a couple of asanas which are inversions, so that automatically helps in blood circulation, takes it to your head. There it promotes better memory, better concentration, better observation, looking inwards. Also oxygen, pranayam, breathing plays a very important role in yoga practice. So it, usually when we're breathing, we're shallow breathing. We take our breath for granted.
True.
When breath is our most important tool, as Luke has always said, we can stay without food for a couple of days, water for a couple of hours maybe, but not the breath. So we have to respect that and use that as an important tool. It not only provides sufficient oxygen to all the organs of our body, but also promotes exhaling properly, removing all the toxic matter. You can only put in something new if you get rid of something old and get rid of something residual or toxic. That comes in through yoga, where we teach to breathe better through pranayam, through asanas, through meditation.
So this is the time you want to pause and take a deep breath.
Yes,
And we're going to be
of
back
course.
with a lot more next time, demonstrations, less talk, more demonstrations,
Yes,
and
for sure.
I think in everyone's life we got to fit in a little bit of yoga until it becomes an addiction. It doesn't have to become an addiction,
Yeah.
but it should become part of your life. It should be as natural as
Exactly.
getting out of your bed and doing some movement that can energize you. I know people who used to wake up to coffee every single morning to feel energized.
Yeah.
And those same people today wake up, roll out a yoga mat, and they get the same, if not more energy, which is
Yes.
real energy, unlike fake energy that caffeine gives you.
Yeah.
And that's the power of lifestyle changes.
Yeah.
Until next time, eat smart, move more, sleep right, and breathe deep. Thank you, Nikki, for your time.
Thank you so
and thank
much.
you, everyone. Talk to you soon. Bye-bye.
Bye-bye.